there's one very important nutrient that prevents a lot of health problems. It's vitamin K2. If you have calcium in your arteries, vitamin K2's job is to remove it, but you have other soft tissues as well. So this is the hip joint. Vitamin K2 tells the joints to release the soft tissue, whether it's arthritis, calcium deposits. It tells it to be released into the blood. The other function of vitamin K2 is to make sure calcium goes from that blood into the bone. And it binds very tightly to your bones and your teeth. So when you don't have enough of this vitamin K2, you get a lot of soft tissue calcification. And you also get a lot of bone corrosion like osteoporosis, as well as cavities. And so the question is, where does vitamin K2 come from? It can either come from our foods, or it can be converted by certain microbes in our gut from another vitamin called vitamin K1. And vitamin K1 comes from leafy greens. And so, of course, if you're not eating a lot of leafy greens, you're probably not getting enough K1. So the next question is, what type of foods are very high in this vitamin K2? One is called natto. That's fermented soybeans. A lot of people take it if they have a heart problem and they're at risk for a stroke. The next highest food with vitamin K2 is goose liver. It's also high in chicken liver, beef liver. I cannot consume liver. I do have cod liver. Next food it's in, eel. However, you may have eaten these foods which do have some vitamin K2, butter, cheese, primarily from grass-fed animals, salami, there's a small amount in pork chops, and there's also some in fermented vegetables, as in raw sauerkraut. Now, what's really ironic is that here we have this vitamin that has the potential to keep our arteries completely clean of calcium, yet it's in the fatty foods, which we've been told to stay away from. So it's really ironic that we're told not to consume the very food that has the antidote to a really big problem that people have. Also, as a side note, vitamin K2 is a fat-soluble vitamin. Now, one of the toxic effects of way too much vitamin D is too much calcium in the arteries. The toxicity effect from vitamin D causing too much calcium in the blood is so rare, you would have to take hundreds of thousands of vitamin D3 for months for that to occur. Vitamin K2 can come to the rescue and help keep that calcium on the low side. Vitamin K2 is dependent on another nutrient, and this nutrient is magnesium. So if you don't have enough magnesium, vitamin K2 won't work. So think about this. If you have kidney stones or arthritis, or you have calcium in your arteries, and you're even taking vitamin K2, but it's not working, it could be you're just low in magnesium. So when we're talking about calcium being in the wrong place, whether it's in the soft tissue or wherever, magnesium and vitamin K2 together are a great combo solution to solve those problems. If you're taking vitamin K2, you have to realize there's two different kinds. There's the form that's called the MK4, okay, and then you also have MK7. It's natural, whereas the MK4 is made synthetically. I usually recommend using the MK7 version, and I'd also recommend taking 100 micrograms for every 10,000 IUs of vitamin D3. That would be the ratio. So if you're doing 20,000 IUs of vitamin D3, you would take 200 micrograms of vitamin K2